Hi, everyone. Welcome to the June Tell Me More lecture entitled Freedom Within, Strategies for Navigating the Uncertainty of Living with an Undiagnosed Ultra-Rare Disease. My name is Christine McGarvey. I am a UDN PEER member. I am also a participant in the UDN, as is my 9-year-old daughter, and I am also the Pennsylvania State Ambassador for the National Organization of Rare Disorders. I'm also joined here with a fellow peer member, Jessica Swanson.
Hey everyone, I'm Jessica Swanson. I'm a part of UDN PEER. My daughter was a participant back in 2021 when she was just about 9 years old, and we were able to get a diagnosis within 1 year. The diagnosis that she got is a rare disease called CDKL5. And she was actually tested for this multiple times before UDN, which just kind of shows you the importance of this community collaboration, medical advancements, and all that great stuff. Further, one of her comorbid conditions, which goes with CDKL5, is autism. I became a behavior analyst when she got that diagnosis, and I run a company servicing kiddos on the autism spectrum, providing applied behavior analysis therapy across the country. And I'm just excited to be part of UDN and PEER, and this lecture series is going to be a great one. So stay tuned.
Hey, thank you, Jessica. Jessica is also going to be moderating the chat during the lecture, and we'll have a Q&A session at the end. So to start the lecture, I'm going to share my own mental health story as living undiagnosed for over a decade. This is not an easy thing for me to do, as we all know that there is a stigma with mental health, but I believe that the only way the stigma is going to be removed is by talking about it. So before I get started, I just wanted to give some background information. I've had a variety of symptoms throughout my life. I was a failure to thrive baby, but I like to say that I'm thriving. I had projectile vomiting as a baby, and these GI symptoms were persistent throughout my childhood. I also had urinary symptoms where I didn't recognize the urge to go to the bathroom until it was time to go to the bathroom. And really, a lot of my symptoms were either exacerbated or manifested during graduate school and throughout my pregnancy with my daughter. So if I were to sum up my mental health story in 2 phrases, these would be the 2 phrases. There's nothing wrong, or it's anxiety or stress. And really, when I think about my mental health story, it began when I was 17 years old. I felt very nauseous, and it was interfering with my ability to work at school and with my social life. And I now know that this nausea was due to gastroparesis, which is a delayed stomach emptying. But at the time, my mom took me to my PCP, and the nurse practitioner listened to my symptoms. And she said to me that it sounded like I had social anxiety disorder. And I was then prescribed Paxil. Unfortunately, this was before the FDA had issued the black box warning on Paxil and other drugs that it can cause in young adults suicidal thoughts. And unfortunately, I became one of those people. And thankfully, by the grace of God, I recognized what was going on. And I called my mom, because I was at college at the time, and I was taken off the Paxil, and those suicidal thoughts went away once I was taken off the medication. And then So I finished college and I went to graduate school at the University of Pennsylvania School of Medicine. I was pursuing a biomedical PhD in epigenetics. And it was here where really a lot of my symptoms began to manifest and or were exacerbated. And it was there the first time where I fainted. And to be honest with you, the first time when I fainted, I just felt like I was doing too much. I was taking classes, I was working in the lab, I was working on an NIH grant proposal for my research. I've also done ballet since I was a young child and was still dancing 8 to 10 hours. And I was doing peer review edits on a paper that I co-authored, which pretty much didn't leave much time for sleeping or eating. So when I fainted, I just thought that was why. And also while I was in graduate school, I was hospitalized for 6 days with elevated liver enzymes. They never knew why I had the elevated liver enzymes. Interesting enough, my sister was also hospitalized with the same thing a couple of years ago. And then I fainted again. And it was at this point that I was realizing that something was wrong. I just didn't know what was wrong. And the doctors didn't really know what was wrong. But to me, it was pretty clear that the situation that I was in was exacerbating these symptoms that I was experiencing. I was also having migraines at the time. And ironically, it was being awarded the NIH grant for my research that really forced me to make a decision about what I was going to do with my PhD program. And I felt like, there's a real ethical dilemma there because I felt like I was not going to be able to physically complete graduate school. And I didn't feel like I could accept this money. In addition, also, I had a full fellowship to Penn. I couldn't continue to, accept this money knowing that I probably wasn't going to be able to finish. And I was correct because by the time I would have been defending my thesis, I was on disability. But this was one of the most difficult decisions that I've had to make in my life. I also at that time stopped dancing, and a famous dancer, Martha Graham, says that a dancer dies twice. First, when she stops dancing, and this first death is more painful than the second one. So these decisions that I had to make really were devastating for me. And there was a sadness there that permeated my life as a dream that was left unfulfilled. This sadness was only made worse by multiple doctors telling me that there was nothing wrong, or worse, that it was psychosomatic due to stress or anxiety. And that was so detrimental to my mental health, to my emotional well-being. I felt like an idiot. Like I just made the worst decision of my life. And I found myself in this situation where I didn't want to be sick. And yet I was fighting for doctors to believe that there was something wrong and that I was sick. And this was very hard mentally for me to wrap my head around. And it led to a lot of tears and a lot of fighting with my husband. But I kept forging on my diagnostic odyssey because of my strong support system, my faith in God, my family, and my friends, and also through the power of forgiveness. Because I realized that these physicians that were saying these things to me, we probably had a commonality in that we were both afraid of the unknown. And once I realized that allowed me to forgive them and to continue on. And I now have a team of very kind, compassionate doctors who are not afraid to navigate these uncharted waters. I then, as I mentioned, I have a 9-year-old daughter. And when my daughter was 3 years old, I started to notice similar symptoms in her. And it felt like someone stabbed me in my heart. This was, again, difficult mentally for me. I didn't want my daughter to be sick, especially with whatever I had. Right? I'm looking at my daughter and I know what her future looks like. However, I realized that I couldn't bury my head in the sand. I had to help her. And in 2021, I applied for my daughter to the UDN, and she was accepted as a participant at the CHOP clinical site. I was also asked to be a participant, and initially I really was hesitant because of my past medical experiences. And I really didn't feel that I could handle it emotionally if someone told me again that there was nothing wrong. Now, clearly, rationally, by the fact that they were asking me to be a participant meant that they knew something was wrong. But emotionally, this is where I was. I have faced numerous challenges with living with an ultra rare yet to be discovered disease for over a decade. One of the challenges I faced was, at one point, it was clear that I physically could not take care of my daughter when she was younger. And due to my illness and her own symptoms, and I needed a caregiver. And one of the stipulations through Medicaid for the caregiver was that a physician had to certify a letter stating that I was unable to physically care for my daughter. And this was very hard for me. I kind of coped with everything and said, well, I can't be a scientist anymore. I can't be a ballerina, but I could be a mother and a wife. And here I was, and I felt like my motherhood was being stripped away from me. At another point, I was placed on hospice, and that was extremely difficult, not only for me, but for my family. And I remember that I felt like everyone was waiting for me to die. It was a very weird feeling to have. And I remember thinking, am I just supposed to stop living now that I'm on hospice? Am I supposed to resign myself to death? And then just recently, I fainted and I hit my spine and broke my sacral neurostimulator that both my daughter and I have to help empty our bladder and our bowels. And this was devastating because I just had the surgery last year and it was supposed to last 15 years. So I just had to go through that surgery again. In addition, I've had to wrestle with the fact that science, one of my loves, has not been able to help me as of yet. That unlike ballet, where you're given a correction and are able to fix the problem, I'm not able to fix this problem. And lastly, a mother's guilt for giving my daughter this disease. Over the years, I've learned to cope with the uncertainty of living with an undiagnosed disease. I allow myself to have what I call an emotional temper tantrum for 2 to 3 days, where I allow myself to feel and experience any emotions that I'm feeling. If I need to cry, I cry. If I need to scream, I scream. And then, with the help of my various supports, I pick myself up off the ground and I make a plan to move forward. I don't look back. I just keep moving forward. like a horse in the Kentucky Derby. You see, I believe when we encounter suffering, we have two choices. We can respond in anger and bitterness, or we can respond in compassion. Compassion for ourselves and compassion for others. And for me, I will always choose love. This is why I volunteer with NORD and with the UDN as an act of love and compassion for strangers navigating these uncharted waters of living with an undiagnosed, ultra-rare disease. In closing, I'd like to share one of my favorite quotes from Little Women, probably because I am a little woman, 5'1" and 92 pounds. It says, "I'm not afraid of storms, for I'm learning to sail my ship." Thank you so much. Next up, we have Nicole Wheeler, who's going to share with us some coping strategies for adults living with an undiagnosed ultra-rare disease. Nicole, aka Nikki, is a national certified counselor and licensed professional counselor from the Western Pennsylvania, Greater Pittsburgh area. She graduated with her bachelor's of counseling from in psychology from Slippery Rock University and her master's of arts in clinical counseling from Waynesburg University. Nikki has endured one rare disease of narcolepsy and one ultra rare disease of juvenile onset hypophosphatasia. Although these conditions have been a challenge, Nikki has a passion and determination to fulfill her goals as an advocate for others to become a counselor.
Thank you, Christine. Wow, you almost have me in tears. Thank you so much for sharing your story. Okay, let me see if I can get the slide up here on my side. All right. Okay, so yes, I am Nikki, and I am so excited and honored to be here today. This lecture means a lot to me personally and professionally. Like Christina said, I do have a rare disease of narcolepsy and I have hypophosphatasia, but the genetic mutation that I have is ultra rare. There's only 8 people in the whole world that have it, and there's only 500 to 600 people in the US that have hypophosphatasia. Okay, so I want to start with kind of like Christine had said at the end with her favorite quote. My favorite quote is, "You are the author of your own life story." So even though we are given these uncertainties and these situations that we can't control, what we can control is how do we look at it? What is our perspective? How do we think about it? How do we feel about it? How can we make meaning out of it? And like Christine, she's made meaning out of it by advocating and participating in the UDN. I've made meaning out of my situation by being a counselor and advocating in that way. I do have my biography up. There are 4 website links on there in case you want to get a hold of me, need help getting resources or getting referrals or just have any questions. That's where you can get a hold of me. Okay, so to tell my story and try to keep it a little short for you, I do have all the symptoms up of each disease I have, just in case there's somebody out there that is struggling with the same things. That information is out there and that person can look into that diagnosis. But as a child, I always knew that there was something different with me. I was very small. In fact, I think I was the smallest kid in the whole school. I had a hard time keeping up with the other kids. I looked a little different and I moved differently. I had a lot of hypermobility, so I could like bend my back the whole way back and touch my toes, and I could bend my fingers the whole way back. And then I noticed that my fingers looked different. They didn't grow the whole way. My toes were short and stubby. They didn't look like everybody else's. So I always knew something was different. But at the time, I was still a very active kid. And I was very active into college. And then after undergrad, that's when things started to change. I was falling asleep a lot. I even started falling asleep whenever I was driving. And I'm like, this is not normal. So I went to the doctor. They did sleep studies. 3 different times they confirmed that I had narcolepsy. So since then, employment has been difficult. It's been hard to hold down a full-time job. It's been hard to have coworkers and supervisors understand narcolepsy and get accommodations that I needed. I was very cognitively aware and capable of doing things. I just needed some help in different ways, like some leniency to getting to work on time or being able to take a break and take a nap. But most employers were not wanting to do that. So then in about 2012, this was about when I started my master's degree, I was diagnosed with irritable bowel syndrome and polycystic ovarian syndrome because I was having a lot of GI issues, and I was having a lot of female issues too. And they also found that I had a deformed uterus, so that's a birth defect. And so I was told that I'd have trouble having kids, which I did. And throughout my life, I have dealt with a lot of cysts throughout my body from the PCOS, which has been very painful and also took a toll on my mental health. And of course, with the acne, I had started picking at my skin, trying to get rid of it. And that is how I kind of got into the OCD, body focused repetitive behavior community. So I went into therapy and started my recovery with that. And now being a therapist, that is primarily what I work with is obsessive compulsive disorder. So then in 2017, when I finally did get pregnant, I got some more diagnoses. I noticed some issues with my heart racing and palpitations. So then I was diagnosed with some heart issues that were congenital, that were there when I was born. And then my pregnancy and the labor was very complicated and very difficult. I had blood clots, the placenta tore. My daughter was born not breathing. My heart rate went down to the 40s. So a lot of health issues. And then in 2020, that's when things got really, really bad. I started having migraines really bad where I would completely lose my eyesight. I would get nauseous. I had memory issues, muscle weakness, neuropathy. I had joint pain, more reflex issues. So I went to the doctor and went to a neurologist, and they found white matter lesions on my brain. And so they diagnosed me with migraine disease. Well, to give a little history, my brother passed away of brain cancer when he was 21, and he was initially diagnosed with migraine disease. And I said to the doctors, I'm not taking this for an answer. This is not just migraine disease. There's a reason why all these things are happening. Something is connecting all this. So then I went through 2 years of being passed from specialist to specialist to specialist, test after test after test. They thought I had multiple sclerosis. Finally, they did a nerve test, and the neurologist just gave up on me. He's like, nothing's wrong. And so they sent me to a neuropsych evaluator. And the neuropsych evaluator did all this testing, intellectual testing. And I sat there for 2, 3, 4 hours without anything to eat and having narcolepsy, expecting to be able to focus on these very hard tests. And he came out with, oh, your memory issues are from having PTSD and OCD. So there we have mental health diagnosis. But after that, I was like, all right, I am tired of being pushed from specialist to specialist. I'm just going to do my own research. So I looked into all my blood work and I found that I had toxic levels of B6. I had high phosphorus. I was vitamin D deficient. And I had chronically low alkaline phosphatase for years since 2010. So I stayed up till like 2 o'clock in the morning for like weeks researching and researching. And I found hypophosphatasia. Hypophosphatasia is where you don't have the enzyme alkaline phosphatase to break down food so that your bones, your muscles, and your organs can grow correctly. So then I decided, okay, I'm going to make an appointment with an endocrinologist. Made an appointment with an endocrinologist, went there to get the diagnosis, gave them the evidence, and I saw a physician's assistant, and she said, I never heard of this disease. I don't specialize in this. I can't treat you for this. We're going to have to send you to Pittsburgh. And I was like, I've already been to all the doctors in Pittsburgh. I'm not doing this again. So I started crying. I was like, I'm tired of being sick. I just want to be there for my daughter. I want to be a good wife. I walked out. I said to the people in the waiting room, at this point, I was fed up. I'm like, this is the worst doctor ever. Walked out, went home. On the ride home, I get a phone call, and it's from the actual doctor. And they say, we want you to come back. I think I can treat this condition. So since then, they did the genetic testing, and it was positive. I had hypophosphatasia. So now I am getting treated with daily enzyme replacement injections. Some symptoms have improved, some have not. Some days I can get a lot done. Some days I can only be out of bed an hour a day. And like Christine said, it's been very hard to have limitations on my career. It's been very hard to be a mother and have limitations because, you know, cognitively, we want to be active. So that is my story. Okay, so before doing this lecture, I did do some research to provide for all of you, and the statistics say that 1 in 10 people have one of the 7,000 recognized rare diseases. That is 10% of Americans. On average, it takes 9 years for a diagnosis. For me, it took 40 years. People that have a rare disease are at higher risk of anxiety, depression, fatigue, pain, and impaired functioning than 70% of the ordinary US population. And in the UK, people with a rare disease, 69% of them have depression, 82% anxiety, compared to only 17% of the UK population having a mental health disorder. Only 5% have effective treatment. And many of those are initially diagnosed with a psychosomatic disorder, resulting in feeling invalidated, having mistrust, and feeling hopeless. Okay, in my research also, I came up with a list of all the things that people have listed as stressors to their mental health, and that is like having multiple doctors, specialists, services to coordinate, having to coordinate it yourself, travel to appointments. Sometimes people have to go very far, scheduling conveniences, having to take time from work and school, the financial distress of everything, meds, treatments, copays, accommodations, social isolation due to being sick, or having mental health issues, or not being able to move around, also leads to limited leisure activities, and then feeling like a burden that others have to take care of you. One other thing I did before doing this lecture is I decided to watch 2 different shows. One was called Diagnose Me, and the other one was 2 in a Million. I believe they're both on Discovery app. But what I noticed in the Diagnose Me is that in every single episode, each person was suggested to have a mental health issue rather than a physical issue. And then with the show 2 in a Million, that was about someone that had very, very rare condition, being able to find somebody else in the world and meet them that has the same condition. This was very, very important to their healing mentally. So I can't stress enough, if you can find support groups or keep searching, it's very important to find people just like you. All right, so why are we going through this? What is this called? Well, it's called medical gaslighting. And the definition of that is the experience of having a medical concern dismissed or arbitrarily attributed to a psychological or neutral cause by a healthcare provider. Women seem to be affected more. And why this happens is because doctors are very overwhelmed. We don't have enough of them, and they have a lot of administrative tasks, a lot of paperwork, training meetings, and that just leads them to make quick decisions. And they think of the first diagnosis that comes to mind instead of, something rare or something else that might be going on. All right, so of course I'm a therapist, so I always recommend therapy. You don't have to have a mental health condition. You could just have some stressors, trying to make a decision, have a life change. So I just offered this information that there's many different types of therapy. It's personal preference. So you could do relaxation techniques. You could do CBT, which works on changing your thoughts. You could do expressive arts, which is art therapy, dance, music to express yourself. You could do trauma-based, because I'm sure many of us have trauma experiences going through all the medical stuff that we've gone through. There's narrative therapy, where you learn to change your story. And then there's existential therapy, where you learn to process those deep down questions, like what is the meaning of pain and suffering? How do I make meaning out of this? Am I afraid of death? What happens after death? All those questions that are hard to answer. So other ways of coping, like I said, definitely find support groups, find people like you. Journaling, record all your appointments, doctor recommendations, track your symptoms, any side effects to meds you're having, any other experiences, and just journaling how you're feeling. Have a personal advocate. So have either a close family member or a friend that can go with you to appointments and help advocate for you, help remind you of things, anything they can help with. Know your resources. This is going to be a little harder, I think, for people that have higher income or that have private insurance. But people that have Medicare, Medicaid, there's so much out there. You can get a blended case manager to help you coordinate things, advocacy awareness programs, medication assistance, even religious organizations. Your local church can help with certain things. And then mindfulness techniques. I'm a big advocate of mindfulness, especially for breathing. A lot of times I ask my clients, show me what a deep breath is. And they'll go, that's not a deep breath. That's way too fast. You want to breathe in to the count of 4, breathe in, breathe out to the count of 8. So there's a lot of things you can learn with mindfulness things. You can look up on the internet, find a bunch of guided imagery, meditation that can help. Most importantly, trust your gut. You are the expert of your body. Don't let anybody tell you differently. Okay, so finally, this is kind of a model that I came up with myself. And this is what has helped my healing both mentally and physically. So I call it the self model, and S stands for searching. So keep searching for what's going to work for you. Keep soul searching, making meaning out of what you're going through. Keep searching for the right doctors, the right treatments. If something feels off, it probably is. Try something else. Changing your environment. So change it up so it's more conducive for you. If you need to use a shower chair, use a shower chair. If you need to have a toilet next to your bed, do that. Also, who is in your environment? Make sure you have positive influences. If there's negative influence, learn to set boundaries, because you need a lot of positive feedback. So L, love, surround yourself with those that love and support you, and also start learning to love yourself. So I know we feel like a burden, but really start listening to the people around you. What are they saying about you? Like if they're saying, I love you, I want to take care of you, then it's true. So start learning to also love yourself and have compassion for yourself. And F, forgiveness. So there's going to be setbacks with rare disease. There's going to be setbacks with mental health. There's going to be setbacks with anything. So being able to forgive yourself, get back on the horse and keep going. All right. So that is it for me. Thank you very much.
Thank you so much, Nikki. I really appreciate it. I love the self model. Next up, we have, I have the pleasure of introducing my daughter's therapist, Katie Eady. She has been working as a certified child life specialist for 35 years and a licensed social worker for 12 years. She has provided children and their families psychosocial care, developmentally supportive and therapeutic interventions, and anticipatory grief and bereavement counseling in a variety of healthcare settings. She has also worked at Morgan Stanley Children's Hospital, which is affiliated with Columbia Presbyterian Health System, on the Child Life team, at Temple University Hospital on the palliative care team. She has worked in specialized foster care for Leak and Watts in Yonkers, New York, caring for infants and toddlers whose parents struggle with substance abuse disorders, and in community-based early intervention for Ken Crest Services in Philadelphia, PA, as their clinical programs director. She currently works as the children's and young adult bereavement counselor for the Mainline Health System in their home care, palliative care, and hospice program, which is how I got to meet Katie.
Thank you, Christine. It's wonderful to be here today with all of you. I'm truly honored as an advocate. I know Christine's story and Bridget's story, and Nicole. Thank you for sharing your story, and to all of you who are here with us. I will just say that 40 years ago, I had a flu virus that led into myocarditis and Guillain-Barré syndrome. Ironically, that were two side effects for some who survived COVID. I was very blessed, sick at age 8, fully to be recovered by age 12, which was many years ago. As you can tell from my bio, I'm probably older than most here, but I have a passion in supporting families, specifically, obviously, children of all ages, as well as their parents and caregivers, grandparents, foster parents, in aligning and maximizing their lives and your lives to be as holistic as possible. And I thank NORD and UDN for inviting me here today. I am also appreciative to Audrey Stephanie, who I'm going to ask to slip to the next slide. Thank you. My presentation today is really, again, just sort of giving a general overview assessment of healthy coping responses and psychosocial needs for all of you with your children and the support systems that you have. Of course, you all are the experts of your lives, your children's lives, and really those of us who align with you are there to be additional supports. I'm a true believer that it takes a village to raise a child. And sometimes it takes a larger village to raise a child and to bring a child who may be struggling with certainly rare diseases, undiagnosed diseases, but numerous conditions. And it's a way of knowing that, we truly have the skills within ourselves in terms of empowerment. I will talk a little bit about just promoting resilience, healthy coping strategies, and trying to help you with your children in minimizing stress and anxiety through some supportive and developmental interventions, talking a lot about play opportunities. As we know, play is how children and also even us as adults can help master things in the world. It can foster optimal development and self-confidence and self-esteem, and help us understand some of these very difficult and significant life experiences. And I will also talk a little bit about engaging in emotional expression and enhancing a child's self-advocacy and empathy in the context of patient, person, and family-centered care. Next slide, please. We know, and I'm sure you all know this well, but this to me sort of stands out in what the essence of child and family-centered care represents. You all as parents and guardians may be in situations yourself where you are hospitalized each year, and that can be a common concern for the well-being of your children. We know that the hospital for children and for adults even can be sometimes a very frightening place. And certainly if you yourselves or your children are ill or injured. And we know child life practice, which is the field that I started out in 35 years ago, promotes this optimal development of aligning with children and families and their support systems. And the emphasis is always on reducing the impact of whether it is an adult or a child that is dealing with an undiagnosed illness, a rare disease or illness, a life-threatening illness or injury. And we know that there is trauma involved, as Nicole has mentioned, as Christine has mentioned, when we step into anything that is out of our ordinary world, there is potential for trauma. And the goal is always that we know when we can align and support children and their families, we are helping minimize the trauma, hopefully, and the risk. And again, that is the message of child and family-centered care. Next slide, please. I feel it's important just to briefly, and again, you all probably know this well, but looking at the biopsychosocial model of health. This is something that I've subscribed to throughout my career, that George Engel and John Romano in 1997 at the University of Rochester in New York, happens to be where I grew up, sort of expanded on this. And they talk about how this is really the holistic model for individuals, looking at the social aspect, peers, family circumstances, and family relationships, both individual and collective in nature, the biology of physical health, genetic vulnerabilities, and, effects of medicines, as well as the psychological. We know that we have to look at the whole person, the physical health, the coping skills, the social skills, family relationships, self-esteem, and mental health. We know that resilience in the last 25 years, we know the significance of ACEs, adverse childhood experiences. Most of us have had at least 3 or 4 before age 18, and it may be medical in nature, it may be psychological, it may be something environmental, such as food insecurity, lack of clothing, shelter. We know that is part of this model, and looking at it from a transdisciplinary model approach, the interconnection we know between biology, psychology, and social and emotional environmental factors. These play a huge role in how we look at human development, to health and disease, to information processing and conflict from infancy through adulthood. And again, we know that this is so important when we look to support comprehensive care for all individuals, particularly those like yourselves and or your children or child that may be coping with an undiagnosed or rare disease. Next slide, please. We know that often we are faced with, and many of you, I'm sure, continue to have difficult supportive conversations in supporting our children. And these two quotes just really stand out for me. I've always been a fan of the late Fred Rogers, but how he says it's only natural that we and our children find many things hard to talk about, but anything human is mentionable and anything mentionable can be manageable. The mentioning can be difficult and the managing too, but both can be done if we're surrounded by love and trust. And I think, that is a loaded quote, but it's certainly a truthful one. And the other quote that really stands out for me is the American developmental psychologist and psychoanalyst, Erik Erikson, as we know, is best known for his theory on the psychological development of human beings. There is an Erikson Institute, which many of you may be familiar with, in Chicago, Illinois, that literally was named after Dr. Erikson. And what he says here, I think, is so important. And this is the essence of a lot of what I do with children and families. To play out is the most natural autotherapeutic measure childhood affords. Whatever other roles play may have in child's development, the child uses it to make up for defeats, sufferings, and frustrations. Next slide, please. We know that assessing healthy coping, there are obviously different responses that each of our children are going to have. One thing that I feel that is an easy way to sometimes explore our child or children's experiences, if they're not necessarily a child who is able to easily verbally communicate, whether it's based on their developmental level or just that they choose to express themselves in using other modalities, is to sometimes ask our child to draw two pictures. First, their fear, and second, their wish. And I have found this to be a very helpful way in aligning with parents and caregivers with their children in a nonverbal format, where it gives children mastery and control, the distance, time, and creative means of emotional expression, often sometimes that's difficult for them to convey through talking or a typical conversation. It really is empowerment for our children, that we are allotting there and the adults in their lives. Another option is to use dolls or action figures, stuffed animals, or puppets. I know I'm dating myself there, but puppets are wonderful in a role play where your child can guide the conversation, as often sometimes using these kind of modalities allow a parent, an adult, to assess how their child is understanding their illness, the misperceptions maybe of their new undiagnosed illness, and or symptoms. I realize there's not necessarily always exact wording. Again, you all are the experts. Role play, though, we know can help a child better understand what may occur, again, if known. I know a lot of unknowns within their disease progression. We know that play, again, is that modality for children that allows for child-centered mastery and healthy coping. Next slide, please. We know that obviously there can be many stressors for children and teenagers who are coping with serious illness. 25% of children we know can experience anxious moods, sleep problems, poor concentration, and difficulties when there's an illness in the family. And it may be their illness, or it may be a parent's illness, or another significant adult in their lives. I know this is an older statistic. It probably is higher now, certainly. And we also know that children and teenagers' anxiety can be decreased when the truth about their treatment or illnesses are discussed in concrete language. Again, what is known, I recognize very much that this can be challenging for all of you because not everything is always known, but allowing children to play and rehearse coping strategies, which I will share in a minute, with creative expression, with art, as Nicole touched upon, and developmental and therapeutic play modalities. Examples are medical play. Many of you may be very familiar with this if your children have gone into hospitals or healthcare settings where child life specialists like myself allow children to use real medical equipment and to do medical play, either on the child life specialist, another adult, maybe their parent, themselves, a doll, that allows them to work through even things that are not hurtful, like injections or blood draws, can still, things when someone brings a stethoscope or a blood pressure cuff, that is still something that is invasive, and it's not something that's normal or natural. And again, allowing children to have that mastery really can make a difference. Things like calming tubes, I just have a basic one here, is something that I do often with children and with adults, teenagers. They're very simple, taking usually bottled water, plastic tubes, mineral oil and glitter and beads and whatever else. This also can be something that can help with mindfulness and ways of just supporting anxiety and decreasing. Music, as we know, is a very powerful modality. That goes without saying for all of us. Legacy building is also something that sometimes I think is misunderstood. Legacy building does not always involve loss. Legacy building can have intangible aspects where we talk about, who a child can talk about who they are, what they love, what their passions are, and interest and goals and values. And that, again, helps foster self-esteem, ways of helping foster mastery and control. Tangible legacy is, yes, much more often related to grief and loss, but recording records of their life, written stories, messages to loved ones, pictures, gifts. But that is something that is really something that can be very powerful for all children and even adults, teenagers. Narrative therapies, as we know, telling our story. I know Nicole touched upon that as well. That promotes mastery and gives back control to a child, a teenager, a young adult who may feel out of control at times. We know that child-centered play or child-directed play is most effective in promoting self-healing and is particularly useful with children under stress. Next slide, please. And again, here are just some, again, supportive guidance. You all, again, are the experts of your child or children, but we know that it is often important to sometimes share some essential things with our children, again, based on their developmental age and understanding. I'm sure you all know when I say developmental age, someone may be 10 years old chronologically, but because maybe they are have been diagnosed as neuroatypical or have a significant intellectual difference, or cognitive difference, they may be assessed to function more on a level of maybe a 5-year-old. So really just meeting, and again, you all know your children best, teenagers, where they're at, letting them share and tell you about what they understand. And again, I know there may be a lot of unknowns of their new serious undiagnosed disease or illness. Even using words like big sick, is a term that I often use for young children as opposed to being sick. So sometimes that helps to differentiate between whether they are feeling like a little stomach feeling of little sick or much more significant. Letting your child share, again, if they know, and I know a lot of undiagnosed rare diseases have very long names that would be probably difficult for most of us as adults. You can create, a shortened version. If that, again, is something that's important, or maybe it's important for your child, if there is a known genetic component, to have that mastery. Again, letting them share, having that conversation with a medical team, again, questions that they may have and about their physical symptoms. It can be very helpful to have our children share the best understanding of what may happen, or I know that may not be possible with their disease progression as this is appropriate. But we do know that the unknown for all of us is far scarier than the known. Next slide, please. And as I just said, we know that a child can imagine much worse, as you all know, things than the truth. I always believe, of course, parents, grandparents, great-grandparents, whoever is that primary caregiver or caregivers, you are the expert of your own child or children. You know how they react, whether they are information seeking or information limiting in terms of what they may need. It is so important to align and to, meet each of our children where they're at when they are struggling. You know how mature they are socially and emotionally, how they cope with difficult situations, tasks, and information that's shared. As Nicole mentioned, I always believe in trusting your gut instinct as their parents, primary caregivers, or guardians. We know, and I'm sure you all know this, that not being truthful can complicate relationships for children and teenagers and adults in their lives. Unfortunately, I've seen this too many times in my work as a bereavement counselor, where amazingly, teenagers and young adults have not been told the truth about a parent who has a life-limiting prognosis. And it actually almost always complicates that grief and loss bereavement journey after that parent has died. We know, of course, there are exceptions, and I know if your child has a rare or undiagnosed genetic disease, sometimes it's not best to disclose information. Again, you are the expert for that particular individual situation, for whether it's yourself or whether it's your child or children. Next slide, please. We know also that there are ways that we can help, again, facilitate healthy coping and resilience. Allowing your child to name a few feelings that they have related to potentially their new illness or their symptoms. Using things I have here, just like with faces. I also have an emoji sheet, and I can send copies of this. But just finding out, what it is that your child is feeling in regards to, that this moment, or when you're talking about their illness. To talk about a feeling that's manageable. Maybe they're feeling, silly in that moment, and then that's tolerable. And another feeling that might be hard, feeling ashamed that they're different from their peers. And that's so important. As we know, most children, even at young ages, want to fit in. They don't have that inner self-confidence or self-esteem. There's always exceptions, of course, where they want to be different. I can tell you unequivocally, majority of the children that I support who have had a loss, I'll just say example, loss of a parent, will say, I'm the only one that has lost a dad, or the only one who's lost a mom. And sometimes that is not the case, but they feel that, they don't want to stand out. They don't want to be different. We know also, talking about where in their body they feel their emotions, and that's an important thing. Where, is it, are they feeling sad? Are they angry? Are they worried? I always try to check in with each child and family member to see where they're at. And, to validate those feelings as well. There's never a right or wrong. Next slide, please. I know I'm trying to zoom along here. Sorry. Just having conversations, again, if you could change one thing, if one thing that's been good or positive about my illness, and I know most people would say what, but honestly, always trying to look at the upside is important. We know that optimism goes a long way. I certainly, as I said, in awe of Christine and in awe of Nicole's story today. Every time I leave Christine and Bridget's home, I have to tell you, I am inspired by both of them, and I'm inspired in so many ways, as are other members of my team. Again, talking about the aspect of empowerment and mastery and better control for a child or teenager with, again, serious illness. This fosters the resilience. It's the reframing of a difficult situation. Next slide, please.
Katie,
I'm sorry, yes.
we're almost out of time.
Yeah, that's fine. Yep, that's fine. I apologize. So, yes, that's okay.
But I would like to see if maybe we can get the slides posted, because I think there's a lot of helpful information in both of these presentations here. I do know that I think we have one question, Jessica, right?
Yes, there was one question. How do we get that play in with seemingly typical cognitive kids, but undiagnosed disorder, which makes in-person interactions difficult to the risk of hospitalizations if they are sick? Most people, what was brought up was most people at this point in the pandemic have given up on masking and are less willing to accommodate.
Did I hear? Yes. Did I hear, Jessica? You were saying that they were asking how to get play in the hospital setting. Is that what they were saying?
No, I think what they're saying is to get play in, to keep out of the hospital, because they're
to keep out of the hospital. Yes. They're saying, are they seeking like services? I'm sorry.
no problem. I think the question is just getting in that play interaction for a typical cognitively developing child, but they're diagnosed and have health issues. And so that play can be risky if we're in a situation where they can't be safe, like from illness and people aren't asking and things like that. Like what's some options there?
Yeah, no, that's a great thing. Now I understand. Thank you. I'm sorry. Yes. I mean, well, one of the things I know that many hospitals do is they utilize video and allowing children to have interaction, not quite the same, of course, not being in person, but to be able to use Zoom, to be able to use, FaceTime, where they are able to interact in a virtual way. It's certainly not the same as being face to face. I will be the first to say that, but allowing for some typical socialization, and also for them to see that there are other children like themselves. I think that's the key point for many children, is to know that they're not alone.
Jessica, I think we have one more question before we wrap up.
Yes. Do you have any advice for families navigating the transition between pediatric and adult care with teenagers in college age? And that came from Emily.
Yes, I do. I actually, Emily, I will be honest, I think that's probably an offline conversation, because that's more than I could say in one sentence. But my email is at the end of my presentation, and my work cell. Please reach out to me. I can definitely lead you to the childlife.org website, which has information. But please feel free to call me or email me, and I would gladly have a more in-depth conversation. But that is something that I do have a lot of experience with, children who are transitioning from a pediatric situation to a young adult situation.
Hi, I just wanted to say thank you to everyone who attended, and especially thank you to our speakers, Nikki and Katie. I am super appreciative of you volunteering your time, and thank you for accompanying me along this diagnostic odyssey, which seems to be epic at this point. Everyone have a wonderful day.
Thank you, Christine. Thank you all. Take care.